It's fall, the season of changing leaves, cooler temperatures, and Medicare open enrollment. For those of us 65 and older, it's the time to enroll, change, or drop our Medicare plans. But there are so many choices. How do you know which one is best for you? Do you need Part A, Part B, or an Advantage plan? And where can you go to find the answers? We'll pose those questions to our panel of industry insiders and see what's new this year. All that on Medicare. Which plan is best for you?
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.
Hi, everyone, and welcome to Medicare. Which plan is best for you? I'm Olga Villaverde. Medicare started back in 1965, but since then, a lot has changed. President Johnson signed the bill into law, and it included Part A, hospital insurance, and Part B, physician insurance, and that's known as Original Medicare. Now, in 1972, Medicare coverage was expanded to include people under 65 with long-term disabilities or end-stage renal disease. In 1980, home health services were expanded and Medigap was added. 2 years later, hospice care was included. Then, in 1997, Part C came about, which allowed for Advantage plans to come into being. And then, in 2003, Part D prescription coverage was added. In the next half hour, we're going to explore what is new this year and what's changed. We're also going to offer some tips on how to pick the best Advantage plan for you. But first, let's take a look at this video.
An official message from Medicare.
Often, things look the same. Exactly the same. Until you take a closer look. At Medicare.gov, you can easily compare Medicare plans and see the real difference. Find a plan that offers you more or saves money. Wouldn't that be nice? Plans change every year, so can your health. Open enrollment ends December 7th. Compare now at Medicare.gov.
Paid for by the U.S. Department of Health and Human Services.
So if you have a question, Medicare does have a place for you to go. You can go to the website. Again, it is Medicare.gov, and their phone number right there on your screen. You can call it 1-800-MEDICARE. And now, let me introduce our amazing panel of experts. Kathy Feeney is president of Florida Blue Medicare. Also joining us, Damaris Keeling, vice president of Medicare Market for Cigna, and Warren Merle, United Healthcare CEO for Medicare and Retirement Florida. I want to welcome all of you to our wonderful evening today. Thank you so much for joining us.
Thank you.
Pleasure.
Yeah. Now, if you have a question for our panel, you can email us. It's so easy at questions@allhealthtv.com. That's questions@allhealthtv.com. Kathy, let me start with you. The video we just saw a moment ago gave the Medicare phone number and the website. Are there other ways to find more information? Because so many people have so many questions.
Great question. Well, Medicare.com is a good starting point for folks who have internet access and want to better understand Medicare and research Medicare plan options in their specific area. Medicare also sends out that you might already have Medicare and You handbook each year around September, and it also can be downloaded from Medicare.gov site. So our research, while many consumers are being able to do their own research independently, about 40% of people would really, really like to talk to a human being, because there's a lot of so. Anyway, we'll get more into that as we move forward.
And that is so important, Kathy. Thank you so much for bringing that up, because Warren, a lot of people, I'm even that person that wants to talk one-on-one with someone. I'm not going to get on the computer. I'm not going to be searching. I want to pick up the phone and say, hi, my name is Olga. Warren, can you hear me? Okay, I think we lost Warren. So Damaris, I'm going to toss that to you. Hopefully Warren will be able to join us. But that personal connection with someone, Damaris, it's so important.
It is. And there's many ways, there's many ways for our Medicare members to search and see what plan benefits should accommodate their medical needs and their affordability. Like Kathy mentioned, Medicare.gov is the appropriate site for them to look. There's the Medicare Plan Finder, where they can go ahead and look for plans and compare. They can ask friends and family also for any suggestions.
And Warren, now that we got you back, it's really important, like I said, that connection, to speak with someone and to just feel that that person cares and is personable. Would you agree? We lost Warren again, so hopefully we'll get that connection up. While we do that, let me share with all of you what exactly is new in Medicare this year. So listen up, this is important. Part B premiums are going down. There's also a slight decrease in Part D premiums and a monthly cap of $35 on insulin that is not subject to the deductible. So Kathy, let's break this down just a little bit. Part B premiums going down. What does this mean and why the decrease? I think we lost Kathy as well. We're having some technical issues, so let's go to Damaris. Damaris, why these changes? Can you talk a little bit about that?
Well, I could add that for this upcoming year, the primary changes on the prescription drug front include a 35 monthly cap on the cost of insulin, which is a terrific deal. You may be able to find plans that cover insulin for less. There's also 0% cost on required vaccine as long as they're administered in accordance with the national guidelines. Vaccines such as flu and COVID are critical to maintaining health, especially for older adults. And there's really no reason to miss them when you can get them at no cost.
And Damaris, I'm going to stay with you because we've still had some issues with both Kathy and Warren. What about just Part D and some changes there? Can we talk a little bit about that?
So on the Part D, Olga, I have to refer back. That's not on my expertise side of the world. I'm sorry.
All right, so no worries about that. Let's see if I have Warren. Are you there, Warren?
I am. Sorry about that.
No worries. Listen, this is TV, this is Zooming, and this is live today. But as long as we have you, we want your expertise here. I have a couple questions for you, Warren. Part D has some changes. Can we touch upon that first?
Well, I think the biggest thing with Part D is that you're starting to see more enhanced coverage, and I think that that's one of the real nice features about what's happening now. I think Medicare is recognizing that, Part D and prescription drugs truly are something that people depend on. And the plans have recognized that. And I think what you're going to start seeing is a lot more out-of-pocket costs coming down. You're going to see $0 deductibles and $0 co-payments, particularly on lower tier medication. So I think that's all very positive news for members that are out there and for folks who are looking to save money with the Medicare Advantage plan.
And Warren, let me stay with you because I have two questions from viewers that I'd like to pose them. One is from Jessica. She says, please tell me about supplemental policies that would cover the remaining percentage of medical cost after Medicare pays 80%. Can you take that for me, Warren?
Sure. I mean, that's exactly what a Medicare supplement policy does. If there are remaining costs that a beneficiary has, those policies generally pick up those costs, and now they come with a monthly plan premium. So you have to balance, if you're considering that, you have to balance whether or not that premium is worth the additional services that you would have covered. I mean, conversely, a Medicare Advantage plan comes with no monthly plan premium, very low out-of-pocket cost generally, and the trade-off there is that you have to work within a network of providers that
I think we're having some problems with Warren's connection as well. Hopefully we'll fix that. And Damaris, I do have another question from a viewer. Let's see if we can work on this one. Denise wants to know why she has high copays on services like stress tests and CT scans, but her mother-in-law, who has the same plan, doesn't have those copays.
That depends on the benefit plan. It depends on the medical needs. Each plan has different benefit plans, different co-pays, deductibles, and coverages.
And when it comes to those plans, let's say someone is now embarking and has a plan and needs to figure out if there's changes with medications or maybe just changes with doctors. Damaris, what do you suggest?
Like I said originally, going into Medicare.gov and looking at the plan finder so you can compare the benefits, it's key. We need to make sure their physicians are on our network, the facilities, their routine prescriptions, and most of it, the affordability, the premiums each benefit plan has.
All right, Warren, I think we've got you back. So let me ask you this one as well. The out-of-pocket maximum for Advantage plans is increasing to more than $8,000. Is that correct?
No, it is. Yeah.
Okay. So here's my question.
Right.
$8,000 sounds like a lot, right? It sounds like a lot of money for out-of-pocket expenses. Can you tell me more about that? And can you explain why, what is considered out-of-pocket?
I'm back. Can you hear me?
I can. I can.
So I'm sorry, Olga, I missed the last part of your question. I'm assuming it was about the out-of-pocket costs and maybe what those are and what people can do about them.
Yes, sir.
You know, out-of-pocket costs are generally expenses for medical care that aren't reimbursed by your health plan. So these include deductibles, co-insurance, co-payments for covered services, plus all the costs for services that aren't covered that you end up paying for. You know, the maximum allowable out-of-pocket for Medicare Advantage plan, as you said, is increasing to $8,300 in 2023. However, it's important to note that most Medicare Advantage plans have much lower maximum out-of-pocket caps. Medicare Advantage plans offer predictable co-pays. They cap your annual out-of-pocket expenses. And once you reach that out-of-pocket maximum set by your plan, all additional costs for those covered services for the rest of the year are covered at 100%. So that cap can really mean peace of mind if you have kind of an
And we just lost him again, but I know he's going to come back, and he's giving us a lot of good information. Damaris, you know, many people are still working at 65, and they have insurance through their employer. So do they have to take Medicare?
No, they do not. They can either go with traditional Medicare, have a supplemental, as you mentioned, or choose a Medicare Advantage plan. The key with the Medicare Advantage plan is that they offer benefits beyond what original Medicare does. So at times it's more affordable and more beneficial to the members.
All right. And Damaris, since I have you, I'm going to stick with you for just a couple of minutes to see if we get Kathy and Warren. I want everyone to look at now Advantage plan. So here's a quick look. Let's take this graphic and show this to our viewers. An Advantage plan is a Medicare-approved plan from a private insurance company, and it offers an alternative to original Medicare for your health and drug coverage. The bundled plans include Parts A and B, and usually Part D. And in most cases, you'll need to use the doctors in the plan's network. So Damaris, let me ask you something. What are some of the things people should look for when deciding whether an Advantage plan is right for them?
So I would start with the network of physician and facilities. They need to ensure what's included in the plan to make sure they continue to use their preferred physicians or facilities. Number two, I would check their drug coverage, make sure the routine medications are covered and at an affordable cost. And pay attention to costs beyond their premiums, such as co-pays and deductibles, and make sure they're affordable.
All right, Warren, I'm going to try to ask you this question and see if we have you for a few seconds to answer. Here we go, Warren. If someone is worried about major medical expenses, which that's so many people, from a chronic illness, let's say, or maybe from an ongoing medical condition like cancer or heart problems, what do they need to look for in an Advantage plan?
Well, I think the most important thing, particularly if someone is dealing with illness and you know, relationships with physicians are extremely important to them. So yeah, make sure that if you're looking to join a plan, make sure that your doctor or doctors or hospitals are in and participating in that network. So I think that's really important for someone who's joining the plan. The second thing that I would encourage people to do is really make sure that your prescription drugs are covered. Oftentimes people dealing with chronic illness or dealing with serious medical conditions require and depend on their prescription medication. So want to make sure that those are in and that they're covered and at a tier level within the formulary that is affordable.
We just lost Warren. So while we're trying to hopefully get everyone back, I want to show those graphics again. Remember, your enrollment has already started. and the deadline is going to be December 7th. But if we can just show those couple of graphics, if you have a question, it's very easy to go to their website. It is Medicare.gov. And I know for some people it can be a little bit intimidating, but again, Medicare.gov and 1-800-MEDICARE. Warren, I know we got you back. I have a question from a viewer. I'm hoping we can keep you. And this is from Lynn. And she asked, I want to see a doctor that is not in my Advantage HMO network, but he does take Medicare. Can I use my Part B to pay for the visit, and will it affect my Advantage plan? Warren?
Yeah, it's a great question. Yeah, that's a great question. Unfortunately, the answer is no. Medicare Advantage or Part C is really an alternative way to access your Medicare benefits. So when you enroll in a Medicare Advantage plan, you must access your benefits.
All right, let's go to Damaris. Damaris, we had a question from Lynn, and she was asking, and Warren was getting that answer in, but she wanted to know if she sees a doctor that is not in the Advantage HMO network, but does take Medicare, can she use Part B to pay for the visit, and will it affect her Advantage plan?
Unfortunately, no. When you enroll in a Medicare Advantage HMO plan, you have to follow their network. That's what Warren was trying to complete at the end of the sentence before we lost them.
But that's why we're a team, and we're starting and we're ending all together. So that's what matters here. This is a team effort. We're having a kumbaya moment. I have both of you, so whoever stays, here we go. Someone wants to know, I have both Medicare and Medicaid. Can I get an Advantage plan too? I'm going to go with Warren.
The answer is absolutely yes. Medicare Advantage plans are often called, for those with Medicaid also, it's a dual special needs plan. So you want to make sure that you look at those. Those plans are very rich in benefits. They're designed specifically for people with both Medicare and Medicaid and provide a tremendous amount of resource, not just in terms of plan benefits, but also plan support for those members who otherwise may need that and may need that extra help and extra support. So those plans are specifically designed for them and really a great alternative if someone has both Medicare and Medicaid.
Okay. And Warren, I have a question from Denise. She wants to know why she has high copays on services like stress tests and CT scans, but her mother-in-law, who has the same plan, doesn't have those copays.
It doesn't seem likely that if someone was on the same plan that they would have different copayments for the same services. Generally, the benefit structure is designed that unless it's a different plan or unless it's a
Okay, let me go to Damaris. Damaris, I just got a question from Jack, and I appreciate Jack holding on with us while we're dealing with all these technical difficulties. He says, I have a second plan from Blue Cross and Blue Shield Federal. It costs me $682 a month. I do not really know if there is another plan that serves the same 20% after Medicare, but cheaper. Can you take that, Damaris?
So I cannot comment on other health plans rates, but yes, you have 20% supplemental insurances like the Blues, like United, like Cigna, and the list continues. Every plan has different rates.
All right.
He needs to shop around.
Like everything in life. And he still has till December 7th. Damaris, I want to talk a little bit about health disparities. Studies show, and maybe, Warren, you want to chime in too. Studies show that while blacks enroll in Advantage plans at a higher rate, they tend to be in lower rated plans with fewer benefits. What can we do to close that gap? So let me start with Warren in case we lose him, and then we'll go to Damaris.
Yeah, I mean, I think that if you look at where plans are offered, and unfortunately, the way that Medicare Advantage plans are set up and approved by the federal government is that they are approved within counties. And in those counties, whoever's residing in those counties, generally those benefits are available to anyone who joins the plan. So, I would encourage people, if they are looking at benefits, I encourage them to shop around. I think Damaris was saying that a few minutes ago as I was coming back in from being somewhere out in the frozen internet land. But no, shop around and just make sure that you can find a benefit plan that suits your needs and that gives you and affords you the benefits that you need and that you need.
Thank you, Warren, so much. Damaris, I do want to get to mental health. It's become a big concern, obviously, after the pandemic. So what does Medicare cover as far as mental health services, and what should people look for? Can you help us out with that?
So again, Olga, on mental health, Cigna owns its own behavior network. So Warren should probably take that call, that question. Sorry.
Okay, no worries, sweetheart. I appreciate anyway the possibility of answering it. I have another question that's coming in, so as soon as I get it, I'm going to go. This is something that I wanted to ask you, and this is actually from my family member that wanted me to ask in this wonderful town hall. You know, as we age, we need help in everyday things, right? Just getting around the house, for example, and that's happening to one of my family members now. Medicare does cover some home care services, but it seems many Advantage plans don't include that. Can you maybe take that on and fill in the blanks for me there?
So I think it's like Warren mentioned, our D-SNP plan, for example, does have extra benefits than our standard benefit plans. A D-SNP plan does have a thing called, I think it's extra help. So it does have some type of home type of care for these members. It all depends on the benefit.
All right. Warren, I have a question from Dolores, and I think, do we have Warren? There he is. Fantastic. Warren, Dolores writes, even having Advantage plan, can I get help for my husband's Alzheimer's? Such an important question.
Yeah, no doubt, extremely important. Now, in order to get help, her husband, I'm assuming, would be on the Medicare Advantage plan as well. If not, then unfortunately coverage doesn't extend from one person to another. Both people or the person receiving benefits would have to be a member of the plan. But I think it's important, for example, if there are, someone with Alzheimer's, and to look for whether it's a kind of a caretaker or care manager benefit that would sometimes allow for respite benefits or respite care to come in. So people who are oftentimes having to manage the care of others, sometimes they just need to take a break and they need to get away. And so oftentimes these respite benefits are available or can be available. And I'd encourage people to look for them if that's a specific need that they have.
And Warren, I want to get this question in real quick before we go to final thoughts. I want to talk about drug coverage now. We mentioned that earlier. The donut hole goes away, but the maximum deductible increases. If I have a lot of expensive drugs, is there additional coverage, if you will, that I could get to help?
Well, I mean, I think under the Medicare Advantage program, D, so the prescription drug benefit, that's why it's really important to examine the formulary, examine the drug list that your plan has to make.
So Damaris, I'm going to now go to you and see if maybe you could end that sentence for us, because we're a team here.
Well, he probably was going to say, just make sure you go to your family and friends and just ask around the benefits. Make sure you ask, or your physicians, or again, Cigna.com, the plan finder. It has great information for our members to compare all the health plans that are out there and the benefits.
And Damaris, real quick, there's so many commercials out there, so many commercials that people see every day from now to December 7th. And I do want to remind everyone that December 7th is the deadline. All the confusion. Do we listen to those commercials, or do we do our homework and just, word of mouth, talk to others, because it's just overwhelming?
So I feel it because I have a dad and an uncle that is going through the same thing this year, and I've been helping them. And I can work for a health plan. I would not have them just come to my health plan. I tell them, talk to your friends, the ones you go to the medical clinic with. Compare the benefit plans, the type of plans that have the benefits, the co-pays, the deductibles. Make sure it fits your need. I can emphasize prescriptions and your physicians are key when choosing these plans.
Absolutely. Well, so, Damaris, since I only have you right now, any final thoughts as everyone is now going through this process, whether they're embarking to enroll or going to change? Final thoughts. And I think we have Warren too. So let's go to you, Damaris.
Quick, remember to ask a lot of questions, and there are a lot of people available to help you.
That's very important. Damaris, thank you. Warren, I think we have you. I'm going to try to get you for final thoughts. I have about 30 seconds, dear. Oh, he just froze. We just had him. But hopefully if we get him in the next 10 seconds, I'm going to take Warren for sure. I do want to show you the numbers again in case you do want to find information, need to shop around. Let's go to those graphics. And it's 1-800-MEDICARE or Medicare.gov. I think we have Warren. Warren, I'm going to you. Final thoughts.
All right. I was just going to say, choosing a Medicare plan really is one of the most important decisions a person can make. Not only for your health, but also for your wallet. There's no one size fits all approach. So you have to take time to understand the options that are available to you. You mentioned the phone numbers, the websites, those are all incredible resources. I'd encourage people to pick up the phone if you want to talk to someone over the phone, if you want to sit down face.
Thank you so much. I appreciate it. I want to thank our panel. I want to thank our viewers for being so patient. I hope we were able to answer some of your questions and get you a better idea of your Medicare choices. Please take care and be safe.
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.